Our closing speakers will talk about becoming a public health nation. The moderator is Dr. Guillermo Willy Prado, Vice Provost for Faculty Affairs and Dean of the Graduate School and Professor of Nursing and Health Studies, Public Health Sciences and Psychology at the University of Miami, and a Research America board member. He will be joined by Dr. Ashish Jha, the White House COVID-19 response coordinator. Dr. Jha has been on the front lines of the COVID-19 response, leading national and international analysis of key issues even before his current position, and has served as a trusted voice in the public sphere. Willy, over to you.
Ashish, thank you for joining me today. The title of this segment is Becoming a Public Health Nation. Our experience with COVID-19 has made clear that the path toward this goal is longer than we might have expected. Can you lay out your top priorities and what will bring us closer to that goal?
Yeah. Willy, first of all, thank you for having me here and really excited to spend a few minutes speaking with you. It's obviously been a very hard couple of years, 2.5 years, in fact. But I want to start off by reminding us that we are in so much of a better place than we were not just 2 years ago when this thing got going, but even compared to a year ago, right? And that for me is a reminder of what is possible when we all come together and work together. The folks who are watching this, researchers across America, academics, scientists, are a major part of the reason we have made so much progress. And if you think about how much science has contributed to building new vaccines, new diagnostic tests, new treatments, that has been, I think, a critical part of why it is that we all feel like the pandemic is in a much, much better place, because it is in a better place, right? Now, in terms of priorities, I like to sort of think both about short-term and kind of medium to long-term. So short-term, here we are, looking ahead to a fall and winter. Know that each of the last 2 years, we've had a pretty substantial surge of cases in the fall and winter. Obviously, hope that doesn't happen, but we have to plan for it as though it were. And so a lot of what we're focusing on the short term is how do we help Americans get through this fall and winter without getting particularly sick, without major disruption, without having hospitals fill up. And really, there are 3-4 key parts of the strategy, and let me just quickly lay them out. One is getting people's immunity up to date, getting people vaccinated. We have brand new vaccines, which we can talk more about, but I think getting people vaccinated is going to be absolutely critical. We're the first country in the world to have a BA.5 specific variant vaccine authorized. That is critical. I think second is making sure that if people get a breakthrough infection, that they get treated. We have treatments widely available. I really believe at this point, everybody over the age of 50 or with comorbidities, if you get an infection, you should get treated. And then we have other tools, right? Testing before you getting together in a large group, or before you go visit someone vulnerable like your mother or grandmother. If you run buildings, making sure you're working on cleaning indoor air, really critical. There's a whole set of things we can do. If we do these things, I really believe we can get through the fall and winter. Let me just take a minute, Willy, if it's okay, to talk about a bit of the longer term, how we get out of this pandemic. So here we are, we just updated these vaccines. My hope is that they will be quite effective for some period of time, but we know the virus is unpredictable. And in the long run, we have got to get ahead of this virus. And the way we're going to do that is by building a very different generation of vaccines that are variant resistant. I'm thinking about pan-Sarbeco and pan-coronavirus vaccines, vaccines that block transmission, intranasal, mucosal vaccines. We have made a commitment as an administration to really push hard on that. Obviously, we can't do it without Congress, but that is the set of priorities. Get people through this fall and winter without disruption, do these things, and then think about that longer term protection that really puts this pandemic behind us.
Thank you for that. And you spent, a little bit of time talking about, the new vaccine and talking about boosters. So I'm wondering if you can talk about the administration's guidance on COVID boosters. I understand there's a new booster that you're recommending for the most recent COVID variant. What do people need to know about getting that booster if they haven't had any prior COVID vaccines versus having an initial shot plus 1, 2, or perhaps all 3 boosters?
Yeah, it's confusing, right? It's confusing for a lot of people. So I'm going to try to make it as simple as possible. And I'm going to try to remind people of what these new vaccines are. So first, the vaccines we had widely available until just recently, the original strain was built against the original strain of the virus from 2.5 years ago. The virus has evolved enormously in the last 2.5 years, and the vaccines have not changed. Now, it's remarkable the vaccines were still doing a good job of preventing serious illness and death, but they were not keeping up. This is the first major update. And as I alluded to, first country in the world to have a BA.5 specific variant vaccine. That's BA.5 is what is dominant out there. Now, why do I think this is going to make a big difference? Based on everything we know about science and immunology, these new bivalent vaccines should provide better protection against infection, more durable protection against infection and transmission, and at least as good, if not better, protection against serious illness. That's the major thing. So who's eligible? Here, it's really simple. If you're over 12, and if you've gotten that primary series, the first 2 shots, at any point in the last 2 years, you are eligible. Now, there's always one little caveat, so I'm going to throw it out. If you got infected recently, you got a booster recently, anything in the last 90 days, I'd say wait 90 days from that time, just to give your immune system a little bit of time. But if you're over 12, you've gotten that primary series, everybody's eligible. And the key thing, Willy, is for most Americans, I believe we're at a point, our immunologists in the NIH and others believe we're at a point, Dr. Fauci believes we're at a point, where for most Americans, this should be a once-a-year shot. For high-risk people, immunocompromised people, they might need additional protection in the spring. We'll see. If they do, we'll make sure they get it. Most Americans, once-a-year annual COVID shot, that's a much, much better place to be than where we were.
Absolutely, I agree. And you have made that very clear. Thank you, Ashish. Do we have any new insight into the science behind the virus, particularly the development of additional variants? What is the best way to arm ourselves against these new variants?
Yeah, it's a really good question. And obviously, we all hope that the variant that's out there right now is the last major variant, that we don't see any major new variants. But I always remind people that hope is not a strategy. In the administration, we're not in the hope business. We do hope, but we're in the planning business, right? Planning and preventing business. So let's talk a little bit about how variants develop, and then let's talk about how we plan and prevent it. Variants have largely developed when you've seen large-scale outbreaks, and they often develop in people who are immunocompromised, who develop a chronic infection. Somebody with HIV, where their HIV is not well controlled, they've not got any vaccines, and they get an infection, and then they have a chronic infection. That has been the fuel of many of the major variants. So what does that mean in terms of preventing variants? It is really critical that we get people who are immunocompromised, people who are elderly, people who are sick, as much immune protection as possible. It's really about getting people vaccinated, and then if they do have infections, getting them treated. Now, I remind folks, this is a global pandemic, right? And that means that we have to do this globally. We can't just do it in America. And I also remind people that every major variant that has hit us, Alpha, Delta, Omicron, obviously the original strain, all of them originated outside the United States. So if we do not have a global stance on this pandemic, it will affect us. So we should do it because we're good global citizens and we care about the world. But even if we want to just simply be selfish, we got to get the world vaccinated and protected. Last point on this, then I'll talk about how we prevent. One of the things that we have been very focused on in the administration is making sure we get the world vaccinated. We've given out about 650 million doses of vaccines to the world, more than any other country by far. But what we also know, and you know this, Willy, is that many countries in the world don't have very robust health systems. They can't turn vaccines into vaccinations easily. And so we have been pushing hard to try to get people vaccinated, to actually get higher healthcare workers, to get those shots into arms. One of the frustrating things for my role in this job has been that Congress has really just walked away from global funding. It's made it much, much harder. I think this is incredibly short-sighted, and we have got to do better. All right, so that's how you prevent future variants. How do you plan for them? How do you prepare for them? It begins with surveillance. We've made big investments in wastewater surveillance. We're working with partners around the world, because what you want to do is identify a variant when it starts up. You want to identify it early. We obviously have demonstrated that we can build vaccines very quickly if we need to. I'm hoping that we won't need to. But the bottom line is you need a very active approach to surveillance of variants. But I also think you need an active approach to trying to prevent new variants.
And thank you for those great points. Clearly we've learned a lot over the past 2.5 years. in your estimate, how can we better prepare for future pandemics? And in your opinion, what are the principal lessons that we have learned from our experience with the COVID-19 virus?
Yeah, it's a great question. As you might imagine, think about this a lot. Think about what have we learned? What do we need to do to prevent future pandemics? How do we prevent bad turns of this current pandemic, right? And I always sort of say we need 5 things. Let me quickly list them and then I'll quickly run through them. We need data, people, platforms, partnerships, and trust. So very quickly, America has woefully underinvested in its data infrastructure in public health, right? Public health agencies, CDC, states and local places have just not made the kind of investments because they haven't had the dollars. And that has really hurt us. We saw for much of this pandemic, we felt like we were flying blind. We didn't know where the cases were, what was happening. It's taken an enormous amount of work. The administration's invested a lot of resources, but we have got to keep going. We've got to have a robust data infrastructure. Data is the lifeblood of a public health or a pandemic response. Second is data's great, but data's got to get turned into action, and action happens from people. You need a robust public health workforce. Where is that really important? You need a public health workforce that could do contact tracing early in the pandemic. We didn't have it. You need a public health workforce that can go out and get people vaccinated, go to people's homes and get them the shot if they want it. Like there are lots of things that a public health workforce is necessary for. We didn't have it. We still don't have it. We've got to invest in that, not just for pandemics. There are plenty of public health crises between now and the next pandemic, and the public health workforce can be deployed very effectively. Third, platforms. I think we got incredibly lucky with this virus and these vaccines. We had done a lot of work on SARS-CoV-1, the original SARS from 2003. We had a pretty good idea of how to build a vaccine against it. When SARS-CoV-2, this virus showed up, boom, we could build that very, very quickly. I don't know that we're going to get that lucky in the future. So we need platforms that allow us to build vaccines and treatments against any virus. It requires a lot of research. This is NIH, this is industry, this is academia, really working on building antiviral drug platforms, vaccine platforms that can be turned on very quickly for whatever virus shows up. Okay, so I think that's sort of the third. Fourth, and then I'll finish up very quickly, and I'm going on a little long here, but I think these are the key principles. Partnerships. I always tell people, there are people who really believe that the public has a critical role to play and the public sector, and the private sector, they're not such fans of. There are other people who are huge fans of the private sector and think the government can slow things down. I remind people there was no way we were going to get these vaccines built without great work in academia, fantastic innovation of the private sector, and serious leadership of the public sector. It was all of those coming together that allowed us to do what we were able to do. That is one of the biggest lessons of this pandemic, is that partnerships, public, private, academic, civil society is critical. Last point, trust. There's some really nice work that has been done by Tom Bollocky and others, published in The Lancet, that looked across the world and said, why did some countries do better than others? The single biggest factor was not how wealthy you were, not how great your health system was, not whether you had single payer or private or none of it. The single biggest predictor was the trust people had in institutions, the trust they had in their government, and the trust they had in each other. Countries with more trust tended to do much, much better. Boy, if that's not a lesson out of this pandemic, I don't know what is.
I'm actually familiar with that Lancet article, and I'm glad you brought it up because it's a really nice follow-up to my next question. So on the flip side of trust, there's misinformation, disinformation. So I'm wondering if you can speak a little bit about, the challenges posed by this misinformation.
Yeah.
And how can we as research advocates really help minimize this?
Yeah, it's a question of our age in many ways, right? I mean, we live in a world, Willy, where bad information can quickly pollute our information ecosystem. And I believe that the best way to counter bad information, and bad information, by the way, thrives in vacuums of information. So when there's no one knows what the right answer is, bad information can really take hold. The best way to counter it is by sharing good information, sharing it early, sharing it often, and building a coalition of trusted voices who can amplify that good information. Now, what I say to folks who are watching, I say this to my colleagues in medicine, in research, and science, is do not underestimate the power of your voice in this. Trust is built one person at a time, one conversation at a time. And that means all of us have a role to play. I've spoken to groups of scientists who say, well, I'm not on TV. I'm like, well, forget the TV part. You do go to the grocery store. You are out there on the baseball field watching your kids play and talking to other parents. Use opportunities to talk to people, to engage people, to listen. By the way, nobody wants a sermon, so you don't have to go out there and hammer them. You want to listen to them, engage them, build trust, because trust is built one person at a time. I think that part is really, really critical. Two more quick points on misinformation and how to counter it. Second is when I speak to folks about the information ecosystems we all live in, everybody says, yeah, those other people, they all live in a bubble. I don't live in a bubble. Everybody believes that other people live in a bubble. And I remind everyone, we all live in bubbles, and we all got to get out of our bubbles. And that means talking to people who don't agree with you. It's hard. And listening as much as talking, not to persuade, but to understand. I think that is really critical for how we begin to build bonds back in our society. Last point is something very specific to scientists. A lot of scientists, obviously, both watching this, major part of where Research America has been such a great leader. I think scientists need training in how to communicate with the public. I think this is really important. Scientists are careful at heart, right? That's the whole point of science. They don't want to get ahead of it. That's a good thing. But in a fast-moving pandemic, we don't always have the luxury of getting all the data and all the analysis. And so scientists have to get more comfortable. I really think this is hard. They have to get more comfortable talking with incomplete data and what that incomplete data might mean. Doesn't mean we oversell what we know, but it also means that we should not underestimate the power of the knowledge we already have. And I think that is really critical. That has got to be done with our scientists, with our public health leaders, with our clinical leaders. I think that'll be really important for countering misinformation.
Thank you. And I absolutely agree. I think that we all have a very important role to play, whether we're academics, advocates. We all have a responsibility in this. Ashish, let me finish, with a personal question. We were almost out of time, and it must feel for you that it's been a whirlwind over the last few months since you started in this role. So let me end with this. What is the most rewarding part of your job?
Wow, it's a great question. I will tell you, this is my first real stint in public service. It's extraordinary. It's extraordinary. I'll tell you why, Willy. I wake up, I come into the office, go home, the whole day thinking about one thing, which is how do we do better for the American people? That is my job. That is actually my entire job around COVID, of course, and around public health and around the pandemic. I'm not worried about, if I'm at an institution, how do we fundraise? How do we, help this one group, or how do I deal with this other? It's a very specific role, which is how do we help the American people get through this pandemic and other public health crises? I think that is what keeps me going. The federal government is like a tanker, like it's this huge ship moving forward. And in public service, you got to build a coalition of people who see and care about the same things you do. And all of you pulling together can move that tanker. And sometimes it's hard to feel like you're making much difference at all. But when you do, when the direction changes, boy, it's obvious to everyone. So it's an enormous opportunity. It's an enormous privilege to work at the White House, as you might imagine, is sort of the privilege of a lifetime. But the opportunity to serve the American people in this, it's unlike anything I've ever done in my life. So I'm really grateful for this opportunity.
Thank you for that, Ashish. And, thank you so much for your service and leadership. As I was speaking to colleagues earlier today, and I was mentioning to them that I was going to have an opportunity to speak to you, I can tell you there were a lot of fans around the room. In fact, I think there was unanimous support. And, thank you so much for all you do day in and day out, Dr. Jha.
Thank you.
So on behalf of the Research America Board of Directors, thank all of you who have turned in over the last 2 days. The Research America Alliance advocates for science, discovery, and innovation to achieve better health for all, with the goal of building new health and medical research champions every single day. Please continue the conversation on social media using the hashtag RAForum. Thank you, Dr. Jha, and thank you all so very much.